warm welcome. At this time, we would like to kindly request that you either silence or deactivate your cellular telephones. Please remember to complete the speaker evaluations via the app and make sure you have downloaded the app, which has been sponsored by SAP.
Good afternoon, everybody. My name is Lindabeth Doby, and we are here to talk about tracking every step. So we'll be talking about traceability and visibility in our supply chain solutions, our supply chains. Today, we want to hear about successes, but we also want to talk a little bit about sustainability in terms of those traceability solutions. There'll be three of us on the panel today. They're both myself, Rupert Swanepoel, and Eric Lugada. And each of us will, to keep the session on time, we're going to introduce ourselves and tell you a little bit about each of our supply chain and traceability experiences. We have a few key guiding principles for discussion. We want to understand how the public and private sectors can work together and use our strengths to benefit all stakeholders. We would also like to understand how to use traceability in terms of accounting for perishable items, managing short and long shelf life items, and how to measure ourselves and enable accountability. So I'm going to start by just turning the microphone over to Rupert and ask that Rupert describe what traceability means to his business.
Good afternoon. I'm going to start this session, a very brief introduction from our side, with a question is why after 23 years are we still busy with the implementation of our traceability system? Very briefly, our company exports about 85,000 pallets, 5 million cartons, about 70 million bags throughout the whole world. And we're a private company owned by producers slash shareholders. What follows, I must emphasize, is a very, very brief summary of our KROMCO process, and there are many, many more processes and control points. The following slides will specifically have icons on them, simply because I don't have the time to repeat everything. But in essence, that the first icon indicates a barcode where you've got scanning processes. Second one is location, where we do location tracking and movements. The third one is where we do so-called cold chain monitoring and control. The next one is QC and QA tests and validations that we do. The next one is monitoring of environmental conditions, temperatures, humidity, nitrogen, etc. Then laboratory testing, where we do chemical residues, phytosanitary tests, etc. Where we have audits and certifications by retailers, standards bodies, government, etc. And then lastly, but not least, we've got a central South African certificate body formed by private and government, where we centrally register the orchards, certifications, and the pallets, etc. Right, so that body is called eCert, and it's an initiative by government, the fruit industry of South Africa, PPCB, which is part of DAF, the Department of Agriculture, and commercial software companies, where we have a central repository of all the different sets of information that's controlled regarding exports. Our process starts in the orchard, where we typically have very extensive pre-harvest audits and tests, laboratory tests, etc., all related to uniquely identified orchards. Then we have the harvesting process, where you have fruit picked into uniquely identified serialized bins. Then we take it into a fruit intake process where we identify these unique bins, and we do laboratory testing to determine quality, etc., of our product. Then we take it into warehousing environments where we cold store it before we do certain pre-processing processes. Again, full on, all these different attributes get tracked, and traceability and the source of the product is maintained. Then it goes into a process that we call pre-sorting, which is a process where we now categorize and classify the fruit into different classes, grades, qualities, etc. There's a multitude of different products that come out of this process, and here we have integrated MES, SCADA, and traceability systems, automation systems, where the flow of the product is ensured and checked, and where the genealogy and whole record of this specific fruit is maintained. Then it goes into cold storage environments, where we have long-term cold storage, shorter-term cold storage, in some cases more than 12 months. And this is in preparation for our next part of our process, which is the actual production side. We have a just-in-time process where we do what we call dedicated packing. The flow of the product is tracked throughout the whole process, from what we call bin tipping right through to the actual packing of the carton. And throughout this whole process, you have integrated MES, SCADA, and automation systems that track the flow of the product and ensure the genealogy of the product is traceable back to source, being the orchard. We have identification automated systems that apply labels, GTINs, application identifiers 21, etc., and uniquely identify these cartons. We've got controlled palletizing processes where we use SSCC codes as pallet identifiers, and each pallet contains unique cartons, and each unique carton belongs to a unique pallet. As alluded to earlier, we have centralized inspection processes, but our own as well, and all these inspection results get updated into central systems, ensuring where the pallet traceability process starts. After that, we have processes to maintain our cold stores and our cold chain, and then those go into racking systems where we ready the product for just-in-time fulfilling of orders and loading of containers. Loading of containers go into obviously uniquely identified containers. These are refrigerated, and at this point we again have central EDI and integration systems and updating of central records throughout the country of these pallets that have been loaded, as well as export documentation processes that link up to this data. During the shipping process, we track and monitor the ships, the containers, and the pallets within them, as well as the temperatures of the containers and the pallets. At the point of arrival, the logistic chains of either the suppliers or intermediaries distribute the product to the various retail points and the points of sale. So as a further process, what we do is we've got what we call callbacks, and where we do forward and backward trace audit by different parties to ensure that we've got actionable traceability. In other words, we can actually fact react and action traceability requirements that could come out of the marketplace. So to answer my question, which I asked previously, is that traceability is about managing the flow of your product at a very, very fine level of detail and visibility. And once this visibility becomes clear, it triggers further business refinements, business controls, business processes, and business intelligence. So it's a journey, and what you find is that your traceability systems tend to pollinate other business processes and initiate other processes within your company. Thank you.
Yeah, thank you, Rupert. Can you imagine if you can do that with produce, what can we do with medicines? So I would like to invite Eric to come up now and talk about his traceability experience in Uganda.
Good afternoon, everyone. I'm Dr. Eric Lugada, the Chief of Party for Strengthened Supply Chain Systems, USAID-funded program in Uganda. It's a national system managed by Management Sciences for Health, MSH. We set out to support the government to set up a traceability system so that we can be able to track and trace commodities. We link these commodities to a central pharmaceutical information portal, which is the National Supply Chain Database Warehouse, which links the two national warehouses we have, Joint Medical Store and the National Medical Store. And these joint warehouses, we set up to link them to the health facilities we have in the country. We have about 6,000 health facilities, 4,000 of them are government, and about 2,000 are not-for-profit. We use the ERP within the warehouses to link ordering and receiving of commodities, and then we link consumption data from the health facility stores to the pharmaceutical information portal so that they can quantify and supply their consumption data, which informs quantification and procurement processes of the country. This is the schematic diagram of what we are trying to do, the entire supply chain system in the country. It's a busy slide, I apologize, but I want you to concentrate more on the left-hand side, I think, where you're seated. We are trying to link the health facilities here to the national supply chain database in the center using an electronic management information system so that these health facilities can communicate their consumption data to inform quantification. At the bottom line, we have the warehouses, the National Medical Store, and we set out since 2000 to link these health facilities to the National Medical Store through a customer self-service portal through which ordering of commodities could be accommodated. So far, the progress is, since 2020, we've linked about 1,200 health facilities and 1,600 health facilities to the National Medical Store. But central to that is the communication of consumption data through the Electronic Logistics Management Information System to the DHIS2, which takes account of the tracer commodities which the country uses to quantify. And so far, when we started, we had only 70%. Right now, we've managed to support the improvement to 85% of all health facilities in the country to link their consumption data to the National Data Warehouse. Central to the Central National Data Warehouse is the online stock status of the two major warehouses. And these online stock statuses are housed in the Ministry of Health portal, which is giving visibility to the government to be able to quantify and determine the commodities they have within their stores. It's an online access. You can, if you scan that QR code, you can also access it from here. It helps the country to drill down the various databases, commodities, baskets of commodities, determine the quantities of commodities left, determine the quantities of commodities which are about to expire, and you can go all through. And what we are trying now is to link and include cost data to that system and structure. And then on the other hand, we've been able over the past 3 years to improve availability of commodity by creating visibility, traceability of commodities in the warehouse from as low as 40% to about 87, 89% availability within the national medical stores that are supporting the entire country. And then on the other hand, we've also been able to link health facilities to the national data warehouse through the facility stock status database. And that this facility stock status database, because of the visibility we have created, we've been able to improve reporting of commodities stock status from health facilities from 4% in 2020 to now averaging 84% in just 3 years. And this platform is what we've created upon which traceability, visibility, and tracing of commodities will be riding to support the national supply chain systems. We have various dashboards, and one of them we've created is that of the commodity online stock status. You can see that the usability and access of that portal has increased It's now overtaken all other disease portals on the national databases. And right now, you can drill down to the location of the health facility, the district, the exact location, and it's also geo-mapped so that we can be able to create a record through which you can track and trace commodities right up to the patient level. The next phase is trying to adopt the QR code reading so that we can track commodities which go right up to the community, to the individual patient who's going to be receiving the commodities. This is owned and run on the government national website, and it's housed within the Ministry of Health. Thank you.
So it's really exciting to hear from both of them, and both in terms of how traceability has enabled them to improve business processes within their organizations. So my name again is Lindabeth Doby. I'm the Senior Digital Supply Chain Advisor with USAID's Agency for International Development. I have been a technical advisor with USAID for about 17 years, and I work primarily with digital supply chain implementations and policy. So what I'm about to discuss are my personal views and do not represent the views of the US government nor any other global donor agency. I had to say that. Okay, so when I first got started within USAID, I was in the HIV/AIDS, the PEPFAR program, and we really, it was emergency mode. We were putting systems out there just to try to get, to understand patient numbers, stock levels, supply, demand plans, just really looking for any kind of data. So putting those systems out there without a lot of thought in terms of interoperability. And so what happened? They were not interoperable. So we were really lacking in the ability to have visibility, to understand what is at the various levels within the supply chain, and difficult for countries to understand what was actually coming into their the country. So what was really lacking in that was master data, and in particular, master product data. So I won't go into what we've been going through the past 7 or 8 years, but we have started to implement steps to try to get the foundations in place in terms of master data, working with manufacturers to make sure that they're labeling their product and exchanging data based on GS1 standards. Through USAID, through our partner, started implementing that with manufacturers in 2018. And we started working with other global donors, and we signed a joint agreement in 2019 so that it was not just USAID, but other global donors that were asking our manufacturers of donated goods to start labeling their products with GS1 standards down to serial numbers and exchanging that data. So we started exchanging master data first, and the next thing we're going to start exchanging will be the transactional data with serial numbers. So also in 2019, we had a global traceability visioning workshop, and it was basically our concept of now that we were asking manufacturers for serial numbers, what are we going to do with those, right? We really didn't have a plan. So in 2019, we had this workshop to start thinking about how do we use that data. So then COVID happened, and we again came together as global donors. We started talking about traceability, but more particularly about verification of vaccine, just to make sure that any donated COVID-19 vaccine could be verified before we gave it to patients. And so the system that came out of that was called TRUST. It's a verification system, TRVST. And not only did it provide us a way to actually verify commodities, but it actually provided us some quick wins in terms of data sharing agreements among multi-stakeholders, manufacturers, countries, global donors, and the company that provided the solution. In addition, we started creating governance agreements. So for us, it wasn't just about the data, but actually getting some of these agreements in place, which have been quite difficult to do. Oh, I'm sorry, I forgot to flip. Sorry. Okay. So data sharing and the governance agreements have been another win for us in terms of that traceability. But now that we have that trust solution in place, it is primarily for vaccines right now, so we're looking to include other commodities. So for instance, ARVs, antiretroviral drugs, maybe we can put those in and see what it's like to capture that data from manufacturers and do something with that data. But again, as we do that, we need to think about all the different stakeholders involved and update those data sharing agreements, update the governance agreements to make sure that as we add more products, more manufacturers, more stakeholders, that we're actually keeping up and everybody is comfortable with what's in that solution. So in addition to that, we are also trying to update our Global Traceability Vision. Again, we came up with that vision in 2019. We really had no experience. And now we've, with a little bit of experience through the trust, looking at other countries that are implementing, healthcare traceability, looking at Rupert and the produce industry, these other areas they're doing this already, right? Boy, we should be able to do this too. So the traceability vision that we came up with in 2019, includes what we call the hub of hubs. And what that means is that there could be multiple different hubs, and a commodity serial number could exist in any one of those, depending on if who procured the item, what manufacturer created the item, and potentially like what country or what region a country or recipient country exists in. So any number of those could be a different kind of hub. And then, of course, you're going to have either a regional traceability or a national traceability system that would enable countries to actually manage their own processes within country. They're going to want to track more events than we necessarily need to see up at the global level. So a hub of hubs. But what we need to do now is figure out how to enable those serial numbers to come down for countries to make use of them, and still to send some data back to the global hubs, for instance, as there's a change of custody or as there's a decommissioning event. We would like to have that back up to help prove out our case, and of course to make sure that, that we're enabling good patient outcomes with our donated products. So some of the high-level traceability objectives that we have for our global traceability vision are linking donated items with good patient outcomes, enabling national traceability systems so that if we start with donated product, they can extend and continue with products that they buy themselves, either locally or on the international market. Enabling efficient supply chain processes. We heard from Rupert and Eric that by enabling some of these traceabilities that they've actually improved their business, and so we'd like to see that happen as well within country systems. We also want to enable regulatory and law enforcement where it's needed to actually also be able to engage and use the system with their work. But we also don't want to limit the market dynamics. We don't want to pick one technical solution and have that be the only one. We want to maintain that technical solution market, make sure that there's a healthy marketplace for that. Okay, so again, just kind of coming back to the hub of hubs idea, I would like to use this session today to help us figure out, how do we make that work? How is that sustainable? We know Turkey, Argentina, many countries already have healthcare traceability systems in play. The European Union, they have the EMVO, so they're doing verification. The United States, they're about to, in November of this year, have their solution go into place. So there's a lot of examples out there for implementation of traceability in healthcare. So how can we take that information, take public sector, we like to have input from people here in the audience, how can we take that and incorporate it into our vision and make sure that, that we help private sector and public sector work together in low and middle income countries to enable that traceability. So I'll stop there, kind of our problem, and I'm going to start asking a few questions of Rupert and Eric, and then I will turn over to ask a few questions from the audience, and then we'll go from there. Okay. So first, and I'm going to go sit down in a second, but as I do that, Rupert, first question's for you. When the decision was made for produce manufacturers to start using GS1 standards to enable traceability, how much consensus was among all the producers, and how does that consensus look right now, and how'd that change?
Initially, there was consensus regarding the requirement for traceability, but there wasn't consensus when it comes to, for example, numbering methodologies to use for serialization. Initially, systems were developed to accommodate different numbering and serialization methodologies. And over time, we found that the general migration after the different parties understood what GS1 numbering, for example, was, migrated to a central numbering system, the GS1 numbering system. So ultimately, where initially things started off with uncertainty, there's most certainly is consensus now about that route.
Can I ask real quick, how long did that take to come to consensus?
The process of migrating and moving over from the various numbering systems into a standardized system took about 5 years.
Maybe one more quick question for you before I go to Eric. So how did government and private sector work together to make the produce traceability solution a success?
Initially, the process was purely driven by government, and it took quite a while. But there were certain commercial imperatives in the fruit industry as a whole, which required us to escalate and increase the tempo of change. And when that realization came along, there were external market forces. To cut a long story short, there were potentially we couldn't export to certain countries in Europe and the Far East if certain systems weren't in place. That escalated the whole process. Private sector got involved, funded the whole process, and ultimately you've got a governing body that controls the central system, but you've got very much a collaboration between government and private sector and private industry regarding the system.
Great, thank you. That's really helpful. And I know that at least through regulation, that's how some of the medical or pharmaceutical supply chain systems have happened in countries. So it's nice to hear some of that parallel. Eric, I'm going to ask really quickly for you. Regarding traceability solutions, what does sustainability mean within the Uganda context, and what are your current plans to get to sustainability?
I think sustainability is approached from 2 levels. The first one is putting the government, the national systems in charge. We've so far supported the government to put in place a supply chain warehouse, which is housed within a Ministry of Health online portal for managing health and managing the entire health information system in the country. So they already own that. We've also helped them to galvanize and mobilize health facilities to keep reporting. And because we've set up a digital platform, which is linking the warehouse to the health facilities for ordering and receiving commodities, and at the same time established a digital platform, which is linking health facility stores to the national supply chain warehouse, which is the pharmaceutical information portal, the government has control. It's also helping with governance and leadership, and at the same time promoting sustainability. Because if the health facility, as I showed you a QR code, with that QR code anywhere in the world, you can access the online national warehouses, you can access the online health facility stock status, so the government has visibility of the supply chain system. Then secondly, we are also linking that to the patients for free medicines, like reproductive health, maternal and child health, the vaccines. We played a crucial role in establishing a supply chain system, which we call the Emergency Electronic Logistics Management Information System. And we want the private sector, which sees over 60% of the health facility of patients in Uganda, to participate in managing patients, especially through the distribution of free commodities. We are using the advanced technology, QR code reading of smartphone technology, to track these free commodities through the private sector, but link them to a health facility store, which is national. So it's easy for the private sector to participate, and that way we're introducing ownership of managing health commodities to improve pharmaceutical services in the hands of the government, dealing with the private sector, using technology, the digital supply chain backbone.
Thank you. And I will mention that Eric and I had a few conversations ahead of this, and I think some parallels and some working between the global donors there also have helped. We're aligned and funding, so I think it helps also with some of that. So Eric, another quick question for you. Where do you see private sector working best for Uganda's traceability?
We've encouraged the private sector to work with the government, but also we brought donors synergistically to support the programs. For instance, the main funder is USAID for our program, but the Global Fund has also queued into funding this process. They've actually given us resources to begin to support the country to put in place a GS1 mechanisms for tracking and tracing commodities. We're now getting the private sector. In phase 1 of it, we're going to develop a 5-year roadmap. And in the 5-year roadmap, we are collecting stakeholders together so that we put legislation in place, and then we're engaging the governing body, which is the National Drug Authority. And part of that steering committee is going to include local manufacturers and local importers of commodities, so that together, as stakeholders, including donors and development partners, we develop a roadmap and structure a process for serialization of health commodities that come into the country. So the private sector is engaged right from the beginning and a part and parcel of designing and defining what serialization, track and traceability of commodities in the country is going to look like.
Great, thank you. I would like to open it up in case there are any questions coming from the audience. I can't see very well. Are there any questions? I see, let me.
Many thanks for the panel. My name is Marasi Mwencha from Global Fund. Eric, I just posted a question in the app for you. You showed a slide in how the improvement or actually implementation of visibility initiatives has helped improve product availability from 2020 onwards. Is that the only intervention that was responsible for that improvement, or was there more that you did to enable that visibility? And I think if you can also talk, both of you, to a lot more about the challenges that are faced in trying to implement that end-to-end visibility.
It's a lot more. We did 2 things. The first one is what I showed, which is looking at the technical capabilities, strengthen the pharmaceutical system. But overriding that is the governance, leadership, and management arm of it. Part of our result area was to support the government of Uganda to put in place a 10-year roadmap for ownership and sustainability of the supply chain system. And with that, we took a one government approach where we have all relevant government ministries, departments, and agencies participating. So the government has committed to fund supply chain, to purchase commodities. Local government has committed to ensure that the district leadership, subnational level, are managing and holding health workers accountable. Minister of ICT has committed to provide ICT technicians at the district level, provide internet, and the Minister of Energy has committed to supply electricity to where there's no electricity. And overall, the Prime Minister's office, which is the leader of government business, is managing this one government approach. So that governance piece has been critical in enforcing and ensuring that guidelines, rules, procedures are followed as the technical components of the supply chain thing processes are going on. What's the second question? Sorry. The challenges are immense. The first one is what we call getting health workers to use. You see, the documentation and reporting was 3% when we started. How do you get health workers to do that? Many people theorize about change management, but change management has been facilitated by the introduction of visibility. If the district health officer can see that you're not reporting, or the permanent secretary has the power to look at the online stock status in her hands, that has facilitated compliance and use and reporting of digital systems. So that has facilitated and quickened the process of change management in the use of digital systems and reporting in general.
One of the major challenges when it comes to, from our perspective, from traceability, is the buy-in of the people who actually do the operations, and the benefits to them in their different areas of control regarding what flows out of traceability. So the challenge in our specific instance was, in actual fact, sometimes when you do traceability, you do it at a very fine level of control and detail. And to have the users actually experience the benefits that flow out of those controls. So from a challenge point of view, is the change management process, getting people accustomed to being, in inverted commas, controlled, but also the benefits that flow out of that.
And who else? There you go.
My name is Sam Nyingi from ARC. I'm just interested, Eric, in knowing the intervention that you've had. Has it advanced in terms of getting information real time, or for purposes of the stocks availability, you still have to wait, let's say, a month after for facilities to report? And what does that mean to the system? And then my second one is, how does it work at the decentralized level? Because I think you showed us a map and there were some sections where there were reds. You know, remember, you know, certain regions seem to be lagging behind vis-a-vis, the predominant ones that were green. So how is it working at that level? And perhaps what are your experiences in terms of addressing challenges in bringing everybody together?
It's real time. Part of that slide I showed, which is the entire structure, is that the USAID has invested about 6,000 computers, and the Global Fund has added 420, and Global Fund has added 600 computers. Now these total computers are being distributed to about 520 health facilities in phase 1. And what we are doing, we are linking the stores, the medical stores, to the dispensing unit. We are creating local area network, and then with the provision of internet, we can be able to real time see that health facilities are reporting data. So every time you log on to the pharmaceutical information portal, the supply chain data warehouse, you should see health facilities which are not reporting. Because reporting was so poor in the beginning, we're just ramping up. Currently, we have just about 1,200 health facilities which are reporting consistently. Now we are working with the districts at the subnational level to get the DHOs and the district administrators to also view and see whether their health facilities in their jurisdiction are reporting. We've given them online access, and they are constantly monitoring and holding the hospital administrators accountable for health facilities which are not reporting. We hope in the next 2 years, we'll see 1,200 health facilities improving, and maybe in the next project, we'll need to get more computers, so we link as many health facilities into these digital platforms as possible. So that's what we are working on. It's still work in progress, but in 2 years, it's already yielding results, and we believe we are on the right path.
We're short on time, so I'm going to ask Rupert one final question. Any advice that you have for the healthcare sector in terms of traceability implementation?
Start. I think we often tend to overthink processes, and we look at the final goals that we want to achieve. What's important is to tie in with what Eric said, is you dial in the accuracy, you dial in the control points, you improve those processes over time. And there are very much true business benefits. And what we have found from our organization point of view is that there's cross-pollination into general knowledge of systems thinking. So although it might, in some cases, people think this is just a very specific use case, what you find is that other business processes, people start getting attuned into the fine controls and management processes that you have. And then finally, I think what's very important is to have open systems and flexible systems. Because one has a process versus a waterfall once-off implementation, your systems have to adapt and be flexible as the business processes change, and also be open to accept information from different levels and different systems, instead of deciding on one final methodology of how one's going to ingest data from a certain source system. That's my side.
Thank you. We're out of time, unfortunately, but I can't thank both of you enough for coming and sharing your traceability experience with us. We have a lot of work to do, but I feel really good about where we're going.